Assalamu alaikum, everyone. Hold on. Okay. Alrighty, thank you very much, Dr. Zaki and the whole Health Tech Asia team for giving us an opportunity to share our thoughts with all of you and take you through a journey. So I was reviewing the panel today and the whole guest list of the 3 days conference. I believe I'm very few of the people who are not clinically qualified to call us doctors and everything. But just to give you a quick background, I have been helping healthcare practitioners and healthcare organizations across the world for the last 10 years adapting technology. MazikGlobal and me as part of MazikGlobal have been doing healthcare implementations in North America, Canada, Saudi, and UK. And we are very, a broad focus, and we are very committed towards adding our value in the health tech space. All right, so coming back to today's topic and the whole agenda of this conference around Agentic AI. So I don't want to go into those technical jargons that we normally do every day, but let's come up with a very common examples around how and what Agentic AI is. So before that, humans, if you want to understand what is a human, so human is a combination of data and interactions. We have knowledge and we have interactions. That knowledge consumed in those interactions in certain situations to come up with certain experience. So first thing first is data. Can anybody who learns everything about diagnosis and the medicines can become a doctor? Certainly not. So only data cannot help anyone qualifying to be a doctor. Similarly, an AI without data is nothing else. It has to have that data. But how that context comes into play, how that situation comes into play. So that situation for humans is interaction. For softwares, it's integration. Humans interact with each other, transfer of knowledge, and a decision comes in. Multiple surgeons, clinical staff sits together, take a decision. Similarly, software systems integrate and take a decision. So softwares have data, then they have integration. That integration gives them the context. So in terms of Agentic AI, if your hospital systems are not data ready, your data is not correctly structured, and your systems are not integrating, there is no value addition, there is no all the big wonders, all the buzzwords AI is coming and surprising us in the past 2 years. I say the world was different post-COVID, but world is different post-AI as well, but without data and without integration. I was reading a study last night that was all about what are the technical challenges in adapting AI across different sectors. And you must be surprised, the least challenge we have as an industry is technology. Technology is not a challenge anymore for AI to get adapted across sectors. The biggest challenge AI is facing is integration and the siloed systems. We have got solutions that are ages old that were designed to work as an independent software without having integrations across different systems. So that integration is a challenge. So my analogy for AI or for technology, by personality, technology is introvert. It's hard to socialize technology. It's hard to integrate technology. So what we have to do is the Agentic AI piece is more like you have data ready, you are integration ready, then you can move towards adaption. And that's what we are working with. And you don't believe we are working with top public sectors in the first world countries, and we are working on a POC or a solution for eye donation. In that first world country, there are 100 candidates of eye donation. Eye donation happens when somebody passed away, and the only window you have is 24 hours. And there are multiple contraindicators that needs to be evaluated, like somebody who's in dementia or neurological disease cannot have the eye transplant done. So in that first world country, 100 people that passed away, 60 were good candidates, fit candidates for eye donation. Only 2 people passed through the evaluation piece in that 24-hour window, and only 1 donation happens. And people who are, you guys must be experienced, of 1 eye donation almost suffices more than 7 or 8 people, the cornea replacement thing. So that's the challenge of first world. They have got the best systems in the world, and they are really having an issue. Why? Because it takes 2 nurses and a doctor, or team of 2 nurses and doctor to evaluate that a person is fit for the eye donation or not. And if somebody passed over the weekend, there is no one to take care of that. So we are working with them how to automate, how to make that thing happen. And the first challenge is data. Systems are not data ready. How do you make a trigger to initiate AI? That triggers are somebody passing away, somebody is about to be announced as death. All of those indicators needs to be pushed into a system that has time-bounded use case. So these are the statuses of first world where we are working with. We are working with another organization around, they've got a employee satisfactory index. People in healthcare knows how burdened everyone is from the resources perspective, from the personality. So they are working on how their employee satisfactory index is. And what the problem is, that satisfactory index happens at the end of the year with a survey and everything. And then you have some index, your employees or your healthcare staff is happy, not happy, or whatever. So they are working with us to unify data across different systems so that we can predict early. How an employee is happy if he's not overburdened or she's not overburdened, he has got ample resources to perform their job, he is treated well. All of these are result of healthcare transactions. If you are getting enough people to support you in a surgery, if you're getting enough people in your OPDs to support you, if you're getting your appointment booked on time, if you're getting patient onboarded on time, the triage nurse is doing the triage accordingly, and everything that is happening in each room of that hospital or a clinical facility gets transformed into the system where everybody can access it. So all of that requires data integration, data unification into a platform. Then we build agents on top of that. You can communicate, you can converse in your natural language on that platform. So the soul is data. And this where technology companies like us, we have been the data analytics partner of the year for Microsoft last year, 2024. And me and my team are very proudly from Karachi. We worked with Microsoft to release the first healthcare data accelerator for the clinical industry back in 2019-18. So we work hard on data and we help technology, the hospitals and healthcare organizations, how to get their data things straight. So that's one piece of thing. Second is integration. And lastly, before like Agentic AI piece, a very common analogy, like the conversation from what Dr. Zaki has saying, AI gonna replace or something. So you guys all remember there was a time we used to call the call center of a telecom company and ask for our balances, ask for minutes left, ask for data left. Then there was a time we came up with a code that we dial through our phones and it gives us a message that this is your data left. Does that automation took away people's job? Does that automation causes all those things that people are saying AI gonna cause it? That was an automation you did, but do we really need enough call center agents in the world that keeps on, like 7 billion people keep calling a call center agent to ask for something? We don't need that. But that's automation that helps human life, humankind. Similarly, the other part that talks about another analogy, we used to, when we do a transaction few years back, bank gave us back a transaction SMS, it still gives us. But it used to tell us the balance, that you did a transaction of 500 rupees, this is the X amount left in your SMS, in your bank. But then they stopped doing it. Why? Because it's an issue of data breach. That information is not to be good in your inbox, available for anyone who has got access to your phone. So that's a data breach. And that's data security that they done. Similarly in AI, before AI, so one thing is the automation piece, second piece is data security. So apart from integration, the biggest challenge when you go for AI adoption, second is your data breach, your data security piece. Does AI has the access it needs to have, or it has access it shouldn't have? So this analogy of having this SMS I told you similarly gives what access AI should have over your system. So your data should be right, your data should be secure, because AI can be integrated with a prompt that can be raised by anyone. So somebody who's raising prompt may not know what he or she should access, but your system, that we call it your orchestration layer, the system that orchestrates between a humankind and an AI system should have enough policies and enough data security that it should control whether the prompt should result in data that should be accessed by the person or not. So that's called AI governance and AI security. And that's another specific, that's all come under ethical AI space, which everyone like UNESCO, United Nations, all the governance bodies in the world are trying to implement. Microsoft is investing heavily on ethical AI, that what should be done, what should not be done. what should be the bias around it? Like if I ask, you guys are doctors and qualified clinicians, so there are nuances, there are biases. It's like if I'm sharing the ethnicity, if I'm sharing the background, if I'm sharing the gender of a patient, the answer should not be biased around that. The answer should be a clinical decision, not something biased by whatever data has been trained or provided to AI. So bias is another area where clinical decisions are impacted, and that can only be done with, again, setting up the right data. So first of all, if anybody who's working towards data, towards AI, needs to understand how good are their systems from data perspective. How many healthcare interacts with tons of systems every day. You have an appointment management system, you have a laboratory management system, you have a CT or X-ray imaging management system, you have got all those allergy, drug to allergy management systems, drug dictionaries, routing systems, scheduling systems, so many systems across the world that get integrated when a one clinical transaction happens. So are we ready from that perspective to have our systems adapt AI? Or we are just, again, want to mimic what everyone is trying to do with all those Gemini nano bananas and everything. So certainly not in that sector. Lastly, before I finish my thing, I want to provide you what is from the agent, that was AI LLMs. Now what is agentic AI? For us, how we define agentic AI? Agentic, every agent is, like you call to, I want to have an appointment. I call someone on the front desk, get myself an appointment. That appointment gets confirmed in the system. Then it goes to the front desk or the receptionist of the GP. That GP receptionist checks you in when you walks into a clinic. Then he or she routes you to a triage nurse. You get all those weights and everything done. Then you go to an actual GP. Then you have got some recommendations in an encounter that is happening with that GP and the follow-ups and everything. So all of them individually are use cases. I need to do, everyone in the world needs to call centers. We have now got WhatsApp appointment booking. We have got phone appointment booking. We have got mobile apps appointment booking. Every single thing is an agent. And that agent use case, so we say every use case you have maps to an agent. Now it's up to you how you want to, which agent, which use case is important. Like I want to have more doctors, but we don't want more receptionists. We want them, humankind, to do more productive work. So that particular piece is your use case, and that use case maps to an agent. So we have a walk to fly approach when we say AI adoption. Identify your use case, that is laborious. That has to be done the same way 100 times a day, and then that requires more human being than the value it is giving back. A doctor, no more how many doctors are there, it's still beneficial for mankind. But we don't want people to pick phones, 50 people picking up phones. If a bot is picking up phone and qualifying which one should be go to a doctor for telemedicine, which should go for a nurse, which should go for a physical therapist, and which should only a customer satisfactory call. So pick up your agentic use cases, map to agents, set your data right, implement the right security, and you are on your path. Constraint of time, I need to finish my things off, but definitely I'm available today if somebody wants to talk and discuss. We're happy to talk on our stall or anywhere. Thank you very much, guys. It was nice talking to you.